I just going to do, just as sort of the Albany host and knowing so many people, I'm just going to say hello and welcome, and particularly thank the Rockefeller Institute, Tom Gaze, Bob Bullock, and all the good people here today for giving us this wonderful venue and for doing the audiovisual. And nice to see so many old friends here, and so welcome. And I'm going to turn it over to our two co-chairs, Mariana Chilton first, to talk a bit about the commission, and Robert, who many of you know, just to introduce himself and say a few words, and then we'll get right to you, Kate.
Good morning. Thank you very much for being here. My name is Mariana Chilton. I'm the co-chair of the National Commission on Hunger. I'm very happy to be here with Robert Dorr, the other co-chair. The National Commission is a bipartisan commission appointed by members of Congress to address food insecurity in the United States. We are tasked with, first of all, looking at our nutrition assistance programs and working to address food insecurity, utilizing existing programs and funds, and also searching to find innovative solutions that include public and private partnerships and other community-based local solutions as well. We've decided as a commission to focus on very low food security at the household level, which is a reduction in the quantity and the quality of food, disordered eating patterns, or when families report experiencing hunger because they don't have enough money for food. We are here to listen and to learn from each of you. We are tasked with creating a report that we submit to Congress and the United States Department of Agriculture in the end of October. This is our first field hearing. This is the first time we're out of D.C. Very delighted to be in Albany. And we, even though there are only 3 of us here, this is an official hearing of the National Commission on Hunger. We are headed to Little Rock, Arkansas, New Mexico, El Paso, Texas, Oakland, California, Portland, Maine, and then back to Washington, D.C. for more field hearings. So this is our first one. We're very delighted that you're here. We are recording. We are audio recording and we are video recording. This is a part of the public record. This will be made available on our website and also on the Rockefeller Institute website. We're very delighted that Rockefeller is hosting us today. So thank you very much for being here. And Robert, do you have some welcoming remarks?
I just want to say thanks, and thanks to Russ for helping to put this together. Marianne and I asked various members of the commission to be kind of the chiefs of certain regional hearings, and Russ has done an exemplary job. For those of you who are New Yorkers like myself, we think it's perfectly appropriate that we would be first. We are first in a lot of things, and I'm very glad to be here and see a lot of old friends. So let's get started.
That's great. Well, I want to welcome our first witness, Kate Breslin, who's the president and CEO of the Schuyler Center for Analysis and Advocacy. Kate's had a long and storied history in the public health field. She also was the project director in the California Budget Project before coming back to Albany. And I have a great fondness and affinity because I worked for 17 years at SCAA before Kate arrived, and really delighted to hear from you, Kate. And I know you're going to talk from a public health perspective a bit and other things. And so the floor is yours.
1 second, Kate.
Thank you.
Not quite.
Okay.
Just how we're going to run this.
Yeah.
You have 15 minutes of uninterrupted time, and then we'll allow 10 minutes for a question and answer and dialogue.
Thank you.
And please make sure that we're always speaking into the mic so that the recording is good. Also, our Twitter handle is at National Com Hunger. We tried to keep it short, but if any of you would like to live tweet, we welcome that as well. Kate.
I will try to live tweet after.
No, please.
After. Not great at it. Thank you very much. It's really exciting and a pleasure to have the opportunity to testify before the National Commission on Hunger today. As Russ said, I'll take an overarching perspective. The Schuyler Center for Analysis and Advocacy is a 143-year-old statewide nonprofit organization dedicated to policy analysis and advocacy in support of public systems that meet the needs of people living in poverty. Schuyler Center often works in areas that fall between multiple policy arenas and systems of care, including public health, health care, and mental health, child welfare, human services, and family economic security. My comments today are framed from the point of view of the work that the Schuyler Center does, particularly family economic security, public health, and healthy child development, an endeavor to be responsive to your charge, which you laid out earlier, and I won't repeat. It bears noting at the outset that in the United States, people experience food insecurity because they are poor. It would be hard to argue that there is any other primary reason other than poverty or low income for food insecurity in today's United States of America. Food insecurity has a public health impact because of the physical impact of poor nutrition on children and adults, and also because of the impact that stress of the insecurity has on families' social, emotional, and physical well-being. A significant and growing body of research documents the significance of early childhood for an individual's lifelong health and well-being. Research is additionally demonstrating what we've known intuitively for generations. Parental stress and instability can have lifelong deleterious impacts on developing children. So while it's essential that we ensure that children have optimal nutrition to set them on a lifelong path to better health, it's imperative that we additionally address the needs of their parents and their families. Food security is integrally tied to health and family economic security. So the policy solutions to address hunger and food insecurity and to reduce the need for government nutrition programs at the highest levels are self-evident: increasing employment rates and full-time work, increased wages and benefits, including a minimum wage increase, sick leave, and paid family leave, expanded, improved refundable tax policies that support low-income people, like the Earned Income Tax Credit, adequate and robust income supports like unemployment insurance, TANF, SSI, expanded access to high-quality and affordable childcare, and robust, accessible nutrition programs. Specifically and urgently, our first set of recommendations to address food insecurity involve many things that we can do to address income security. Here in New York, now, during the rest of the legislative session, and beyond, and nationally, these include raising the minimum wage and indexing it to inflation, enacting paid family leave, expanding the Earned Income Tax Credit, ensuring it's refundable, as it is here in New York, fixing and investing in our less than effective system of subsidized childcare, and continuing to expand affordable health insurance options, especially for low and moderate income people. In the interests of health, healthy child development, food security, and family economic security, it's essential that we protect and enhance access to food and nutrition for children, adults, seniors, and families. There is evidence that programs that I think some of my colleagues will go into more detail about, like SNAP, WIC, Child and Adult Care Food Program, et cetera, improve food security and family economic security. Additionally, evidence demonstrates that families that lose or have reductions in SNAP benefits are more likely to be in poorer health and to forego important services and prescriptions. And WIC contributes to positive developmental and health outcomes for low-income women and young children. WIC participation is associated with healthier births, more nutritious diets, stronger connections to preventive health care, and improved cognitive development. So I'll frame these specific recommendations around food issues with regard to strengthening existing programs and enacting policies that focus on public health. It's important that we maintain SNAP as an entitlement and that we do not convert it to a block grant. SNAP participation increased following our nation's Great Recession because more people needed it. Converting SNAP to a block grant would mean that SNAP would no longer be able to respond to increasing need, as it did so successfully during the recession. Streamline and coordinate eligibility and enrollment. Most SNAP recipients are poor, as are eligible participants in other public means tested programs. One way to get more eligible people enrolled would be by streamlining and coordinating eligibility and enrollment across Medicaid and SNAP, and perhaps other programs, as is allowed under the Affordable Care Act. California, for example, has instituted a policy that automatically enrolls an applicant who qualifies for SNAP into Medicaid. Streamlining enrollment in New York between SNAP and Medicaid is challenging due to New York's complicated patchwork of eligibility levels, as well as different eligibility and enrollment infrastructures. In the future, the New York State of Health Marketplace, which is our exchange, will be a one-stop shop for Medicaid, other coverage, and we hope SNAP and other programs. In the near term, New York should reach out to Medicaid members and SNAP beneficiaries who do not have either Medicaid or SNAP and who qualify to provide them with assistance. Increase participation in the after-school and summer food program, school lunch program, and other nutrition programs. I expect that some of my colleagues will get into more detail about some recommendations for how to do that. But we're very supportive of ways that we can reduce red tape and streamline eligibility by, for example, certifying eligibility by connecting it to other programs and community eligibility for areas with high poverty schools. We also suggest considering policies that reduce the consumption of sugar-sweetened beverages, which have no nutritional value and contribute to health problems. Sugar-sweetened beverages add a significant amount of sugar and non-nutritive calories to the diets of children and adolescents, putting them at risk for a host of future concerns. Research demonstrates connections between the consumption of sugar-sweetened beverages and obesity, poor health, poor oral health, and risk of chronic disease. Sugar-sweetened beverage consumption has a negligible impact on hunger and reduces children's intake of calcium, vitamin D, and potassium to the extent its consumption displaces milk consumption. The WIC program already doesn't include sugar-sweetened beverages and shows results in healthy food intake and dietary outcomes. A study recently published in Health Affairs suggests that banning the purchase of sugar-sweetened beverages with SNAP would reduce obesity and diabetes. A tax, broad-based, on sugar-sweetened beverages should also be considered. Studies have shown that relative prices of food and beverages can lead to changes in how much people consume them. So a tax has the capacity to both reduce consumption and generate revenue that could be used for nutrition and other health-related concerns. We also strongly recommend fixing the cliffs that result in reduced or lost benefits and contribute to family instability and other negative outcomes. In SNAP and other programs, a modest increase in income from an increase in hours worked or hourly wages can result in a significant reduction or loss of benefits. Commissioner Chilton has and her team have a great study on this, and we fully support the recommendations therein. It bears repeating that children, adults, and families experience food insecurity and the resultant stress and poor health because of poverty. The evidence continues to demonstrate that lack of adequate food, stable housing, health care, and other essentials in infancy and early childhood can affect children's brain development with long-term consequences for their physical, mental, academic, and economic well-being. Our solutions need to address the big picture and overarching problem of poverty, as well as the nitty-gritty details of making programs work better for more people. There are no silver bullets. Addressing food insecurity and improving nutrition requires cross-cutting policies and, perhaps more importantly, the political will to implement them. I very much appreciate the opportunity to be here today, and I look forward to continuing to work with everyone here in the room to address these important issues.
Thank you.
Thanks so much, Kate. Questions, Mariana, Robert, to start?
I'm fine. Thank you.
I have a question about a couple of things here that I just wanted to get some clarification. When we talk about expanding enrollment I can't get over calling it food stamps, I'm sorry, because it was a 40-year background in this program. But
I sometimes do that, too.
But I wonder what particular ideas you have. We have pretty aggressive outreach in the state already. We fund a lot of programs to reach out to people, and I know that there had been an issue in New York City, particularly Joel will probably talk about that we had been one of the last bastions of finger imaging food stamp recipients. But I'm just curious what else we could possibly be doing, because when you look at some of the USDA actual figures on the amount of benefits that are issued in the aggregate, it's almost 94% of all the benefits that would be possibly possibly issued if there was 100% participation. And so I just wonder sometimes whether we are really almost doing the best job we can in reaching people. I know one of the areas that we've looked at, and maybe others will address it, but a lot of people tend to fall off the rolls at recertification. And so I'm just curious about your thoughts.
Well, so we've been, because we focus a lot on health programs, we've been having conversations particularly about making sure that we're, and I guess I wouldn't necessarily say particularly expanding enrollment, but maximizing participation. And so I think there's opportunity every time somebody who's eligible applies for and receives one of the benefits, and in this case I'm talking about Medicaid and SNAP. That's a great moment of opportunity to make sure that if we know that person is eligible or that family is eligible, it's a great opportunity to make sure that they're aware of their likely eligibility and use that opportunity to enroll them. So we've been trying to look at, we've actually had a hard time getting data from any of our state agencies about those intersections, we haven't been able to get our hands on the data that tell us where are those gaps, who's on Medicaid who would likely be eligible for SNAP or vice versa. But we think that's just a great opportunity to make sure that the folks who are eligible and need these programs are actually enrolled in them.
Makes sense. And my second question has to do with your comments about the sugar-sweetened beverages. You obviously know that New York submitted a waiver several years ago when we to the USDA on behalf of New York City to eliminate the purchase of sugar-sweetened beverages with public funds, and it was turned down. And but in candor, your remarks about the deleterious effects of consumption of those products are very important, and it was an interesting alignment between the beverage industry and a lot of advocates federally that sort of lobbied against this, where we had a whole series of public health institutions that were totally for it. And I'm just wondering how we can get some common ground on this, because one of the things we struggle with is that being a bipartisan commission just like Congress, there's obviously disagreements around this at times, but I just think at least knowing whether that would help and knowing whether people would simply substitute their own dollars for public funds. But I'm just wondering what your thinking is. How to traverse the political
I think the evidence is, we're seeing more and more evidence about specifically sugar-sweetened beverages. So I think there's a lot of conversation, about a slippery slope, and so I'm specifically focused on sugar-sweetened beverages because there is a growing body of evidence that shows the very, very clear link between sugar-sweetened beverages and obesity, and then several other conditions that are connected to that, and the fact that it has zero nutritional value. And so I think, to the extent there's controversy, there's very clear scientific evidence that those are unhealthy. At the same time, I would advocate strongly for kind of an across-the-board approach around sugar-sweetened beverages. So in addition to limiting their purchase in our food nutrition programs, I would strongly advocate for a broad-based tax. It's frankly embarrassing that sugar-sweetened beverages are cheaper to buy than milk. And I'm not prepared to go into deep analysis of it, but we as a federal government support those industries that develop sugar-sweetened beverages and high fructose corn syrup and all. So I think there are ways of addressing that specific issue that isn't just limited to SNAP.
Thank you. Any questions?
Yeah. I was really impressed with the way that you brought in public health and take that public health approach, and especially call attention to early childhood development. So thank you very much. I think that a lot of people, when they're working on very low food security or food insecurity, they forget about the public health impacts and how this is an important public health problem. My sense is, and what we are discussing on the commission, is the amount of cost savings that could be generated through addressing and treating food insecurity, but then there's disagreement about whether that would be important. Can you talk a little bit about the potential cost savings in terms of healthcare costs and give us some ideas about how we might be able to frame how important it is to address food insecurity because of its public health impacts?
Sure. I'm glad you asked that question. I think one of our challenges when we talk about healthy child development, we know that food insecurity, we know that family stress are both things that affect a child's development. And we also know that the costs associated with problems in early development, we don't see till many years down the road often. We don't see them right away. So we don't see the impact of the parental stress or poor nutrition or poor health in a young child doesn't necessarily generate an emergency room visit. And so what I'm finding is that our policies, and I'm thinking about here in New York, are very focused on the short term. So if the benefits don't accrue in an election cycle or in a budget cycle, we have a problem making the case for them. What we do know, and there's good evidence to show, is that those very early years are extremely important, and that nutrition, good health, the absence of stress or mitigating factors are extremely important, and that we will see costs later in health, in poor educational outcomes, in sometimes even in child welfare and juvenile justice systems much later down the road. So I think we have to be thinking about savings if we do invest well and do strengthen kids early on, we'll see savings that might not accrue just in food programs. So that's kind of why I want to take that big approach, because we'll see a savings accrue in a whole variety of areas.
There are some of us who are very interested in personal responsibility and making sure that families are taking some ownership over their opportunities to make choices. I'm wondering if you can somehow help us understand a little bit about the relationship between lifestyle choices and the public health impact of very low food security, especially when we're talking about very young children. If you can help us disentangle what should be meant by personal responsibility and lifestyle choices.
Well, I think it's fair to say that when there's low family economic security, those choices are diminished. And so the choices about where somebody gets their food, their health care, where they get it and what they get are diminished. So to that extent, I would argue that we need to make sure that there are a wide variety of options. I'm not sure if there's a subtext to the
No, well, I probably didn't phrase the question very well, because I struggle with it as well, because I think about young children and how we need to take a two-generation approach, be able to support the parents or the caregivers of the children, for instance, with subsidized childcare and things like that, that we need to make sure that their options to make choices are expanded so that they can help overcome the issues of adversity and poverty. So that's where I was headed. It wasn't a well-articulated question.
Well, and I think some of it is about making sure that people do understand what the repercussions are. I mean, we've been doing a lot of work, for example, in oral health, and which is very much related to nutrition, as we all know. And so some of the work we've been doing is looking at what are the behaviors around what people put in their babies' bottles. So in addition to taking the broad-based public health approach and making sure people have fluoridated water that helps support healthy dental health, what are the other things? So some of it, I would argue, is about education. And folks continue to put soda and juice in baby bottles, and then let the kid fall asleep with the baby bottle, kind of across the spectrum. So I think there's also a role for making sure that people have education, in addition to making sure that they have choice in terms of what they're purchasing.
If I could just amplify a bit, and I know we're running out of time, but I don't want to open a whole, it'll probably be discussed further, but I think part of the issue of personal responsibility, just as you talk about the fact that we can't really talk about food insecurity without talking about poverty, employment, and wages, we also can't talk about food insecurity without talking about family structure. Absent fathers, multiple single-parent households having far deeper poverty and issues with food insecurity. And so we have to, be fair on both sides of the aisle to talk about opportunity and what people need to do themselves to, and that is a multi-generational issue. That's not something that's going to be solved overnight, but it can't be ignored. So.
Do you have any other questions, Robert?
Kate's wonderful. It's great to see you.
Thank you,
Thank you very
Kate,
much,
so
Kate.
much. Appreciate it.
We hope that we can stay in touch with you as we continue.
Sure, please do.
Okay, thank you very
I'll
much.
leave my cough drops in case anybody else needs.
Thank you for your written comments. We'd like to make this available on our website.
Yes.
Okay, with you? All right. Thank you very much.